Welcome back. We are answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. Remember, you can text your questions. You see the number right there at the bottom, 336-379-5775. All right, this person says, is it 6 feet apart, or have I heard now 16 feet because droplets travel further like a sneeze or a cough?
Yeah, so there has been still some debate on the transmission of SARS-CoV-2. And for the majority, it is a droplet transmission where it would not reach 6 feet. However, if somebody is coughing pretty aggressively, or, where you thought somebody's like singing a bit or screaming, the thought is that it can go beyond 6 feet. I would say that if you're by folks who are coughing a lot, it's just to stay further back.
Okay. This person says, when I walk my dog, people always cross the street when we are approaching each other on the sidewalk. Is that necessary? Can we just walk in the grass and go around them and be safe? What do we need to do?
Well, I think it also depends if you're wearing a mask or not. So, I'm not sure. I think in my community, I've seen folks not wear a mask, and they do walk, or they try to give you 6 feet, more than 6 feet as they're passing you. I believe if you are wearing a mask, try to maintain that 6 feet, but I think it's okay because you're passing somebody in a pretty short period of time. I think the importance is having a mask on.
This person says, I'm still on edge about going into public places, specifically restaurants. Am I at high risk to get COVID if restaurants follow social distancing rules and they wear masks?
So it's a little bit complicated. I think restaurants do still pose a bit of a risk. I know restaurants are doing a fantastic job with making sure people are wearing masks. They provide a mask for you and situate the tables up farther apart. However, again, it depends on the circulation of the restaurant, and it's also maybe who you're also having dinner with. You may not know that there may be risks that way. If at all possible, I think if you can try to eat outdoors in some patios, if you can tolerate it, I think that would be the way to go.
This person is, I'm sorry.
It's not without total risk. That's what I'm saying.
This person is asking, is it still best to put off going to the dentist?
That is a good question. I think it depends on a person's dentition. Like, if you have any symptoms, I think it makes sense to, in terms of tooth pain or sensitivity, it makes sense for your dentist to see you. I know that the dentists have really done some in doctors' offices, they're screening everybody and decreasing the amount of folks that come in the office, and they put up dividers and such. So I would call your dentist's office and find out what their protocol is, to see if that makes sense for you to go see them. But if you're definitely having symptoms, I think it makes sense for you to go see the dentist.
This person says, if kids do go trick-or-treating, should they be wearing a COVID mask underneath, say, a superhero mask?
So that is a great question. I think parents are going to have to be a little bit creative this year. The reason being is that we recommend kids to have a fabric mask on, or if it's like the surgical mask. However, we don't want them to be wearing a mask plus their Halloween mask on top of it, because I think it would be a little bit too suffocating. And then the Halloween mask alone is probably not sufficient enough.
Okay, so maybe you get a fabric mask that kind of matches with the costume. That is the best way.
Correct. And then be creative with some face painting.
Okay, gotcha. All right. We're going to continue taking your text questions. You can see the number there at the bottom of your screen. Dr. Snyder and I will be right back.